All right, everybody, we should be ready to go. Hopefully everything's kind of up and going at this point. Hopefully everybody can see. I just went ahead and shared kind of our first slide. And thank you for joining us this morning. So at this point, what we're doing is just to kind of give, so welcome everyone to the virtual town hall. It is, I believe this is now our ninth town hall, surprisingly enough. Thank you everyone who's joined us this morning, not just in the Zoom meeting, but also online on Facebook. And so we're going to go through just a few things like always. The general housekeeping, don't forget, of course, in terms of us being able to see things. So if you don't mind, please put your microphones on mute. I have gone ahead and muted the audience for right now while we are going to go through some of the presentations. And then we will do some question and answers after the panel has had an opportunity to present. And then we'll take either chat. So that's another thing too. If you don't mind, go ahead and put your comments in the chat, or go ahead and put your comments on Facebook Live. We'll go ahead and pull those comments forward. If you do have a question, if you're in our Zoom meeting specifically, go ahead. There's a raise your hand feature. Please go ahead and do that as well. And we'll go ahead and take your questions as we go through. So like every meeting, I always like to start off with thank yous. And this is something that can't be underscored in terms of just thank you to everyone in our community who's doing their part. And so just thank you to those who have stayed home and helped flatten that curve. And honestly, I think we're doing a good job. So we'll hear as things continue to progress and things open up. I think that speaks volumes to the stuff that we've done locally. But thank you to those who've stepped up and volunteered. We really appreciate your efforts. This has definitely been a community effort. And thank you to those who've made donations. So thank you, Concord, for what you're doing. We, of course, would be remiss if we didn't say thank you to our essential workers. And so thank you to everyone who's out there trying to keep things going. So what I'm going to do is I'm going to kind of start off with what's going on in the current state as of May 16th. Luckily, we still have our stay-at-home orders that are through May 31st at this point, but of course it always has a little caveat that says unless amended by. And so I do know that as of Monday, the health officer is going to be releasing some new orders as well in terms of trying to look to open up a few more things. So we're waiting to hear kind of what the final details are, but we'll know more on Monday. But it's nice to see a lot of it because of how well everyone's done with shelter in place, how well things are going. And I think, hopefully as we continue to figure out what that new normal is going to look like, we're able to kind of move towards that over the course of the next week or two. So, positive news. Some orders that did come out this week, just to kind of make sure everyone was aware. Contra Costa is allowing more vehicle-based gatherings and services. So even things as simple as churches. I know that a number of churches are trying to see how to be creative in the way that they do services. There was a thing in here that says 200 or more vehicles. So I know that there was definitely some direction around even things like graduation. So some of the different schools are trying to see what they can do around trying to do more of a car graduation or being creative. But of course, the next one down is the county still urges schools to do some type of virtual online graduation, only because there can be a little bit of some issues around, whether it be security, trying to keep people in cars, trying to still have the ability to have the social distancing in the proper manner. But again, everybody's trying their best to be as accommodating as possible, especially with what's going on. And especially around graduation. So that's a big one. The other one I wanted to make sure I pointed out to everybody is job and volunteer opportunities for contact tracing. If you go onto the county's website, if you are interested in being a part of that group, they are hiring, or you can also volunteer to work through and help with contact tracing as well. So that was something I wanted to make sure everyone was aware is happening right now. So with that being said, kind of the main point of our talk today that I want to go through is healthcare, and the big things to push out is that it's open, it's safe, and it's accessible. And so what we're going to do is I am joined by a number of different panelists today, and I'll go through that in a moment. But really what we're going to be talking about is we're going to be going through a number of these different questions so that everybody gets an opportunity to better see what's going on in healthcare, and honestly to help kind of alleviate some of the fear that's happening. And so that's kind of our biggest concern, is making sure that people understand what kind of screening is being done when they have to go and get medicine. Also not waiting, because of how important it is to make sure you're accessing care. And there are a lot of things that the different care providers are making sure are available in their facilities. So we're going to be talking to a number of different people here, just to kind of take you through some different scopes of different places that you'll be accessing. So we've got both of our major health systems on the call today. We have John Muir Health, and so Shelley Horowitz is with us today. She's the Vice President of practice operations with John Muir Health. We've got Kaiser Permanente. We've got Marty Arden. Thank you so much. He's a Senior Vice President of the Diablo service area for Kaiser. We have Dr. Miklich. He is a doctor from Muir Orthopedic Specialists. And then we also have Cosmetic and Family Dentistry, Dr. David Brothers, who's going to be joining us, just to kind of give you a different scope of all the different different practices that you may be trying to get in contact with or may need. And so the different things that they're going to be able to roll out for you, and just to kind of help you better understand what's going on. So with that, what we're going to do is we're going to start off with Shelley Horowitz. She's on the phone. So Shelley, let's go ahead and make sure you're in here. Shelley, can you hear us? And let's
hear me.
There we go, Shelley. Okay, perfect.
Okay,
right. And
great.
there is no video for Shelley at this point in time, so just a little heads up. She's just joining us on the phone. So.
Okay, and you do. Okay, thank you, Mayor McGallian, very much, and good morning, everybody. As the mayor said, I'm one of the vice presidents of practice operations at John Muir Health, and I've been with John Muir just over 5 years. When I first came on board, I was primarily responsible for working with our joint venture partners with Tenet and our South County expansion, and then more recently with UCSF Health and the opening of our Berkeley Outpatient Center. And now I am responsible for practice operations. I have oversight for 2 regions, so the East region, which includes Concord and goes out east to Brentwood, as well as the West region, which is the La Miranda area and goes through Berkeley. And so as COVID-19 continues to spread, we want everybody to know that John Muir Health, along with all of our other partners in the healthcare industry, are here for you. Our nurses, our doctors, our clinical and support staff. And we know that there's a lot of concerns, a lot of questions about your health and safety. And we are, of course, very committed to keeping our community safe, not only during this pandemic, but really always. And since mid-March, we contracted our services, along with many others, to those that were considered absolutely essential. So we were focused on emergency and urgent care, certainly treating patients presenting with symptoms related to COVID-19, and very closely following, the guidelines of the CDC and our government agencies. But now, with the indicators being a little bit more optimistic and relying upon all the experts who are tracking these things on a daily basis, we are embarking on what we refer to as a resumption of services. And this is being pursued very cautiously. And we have a mantra, and that mantra is safety first. So I will take the next few minutes to just describe how we're approaching the expansion of care and what new safeguards and procedures are in place. And I think somebody is advancing the slides for me. So if that's the case, we would go to the next slide. Okay. So first and foremost, we are here for you. And as the mayor said, it is so very important that people do not wait to seek care. Our doctor's offices, our urgent care centers, the emergency departments, the hospitals have been open and continue to be open and available to everybody. There are obviously many illnesses and injuries that need to be cared for right away. And so we have been seeing patients in our respiratory and standard urgent care centers as well as in our doctor's offices, although most of those visits have been through telephone and video. And that was really in keeping with supporting shelter in place and trying to practice as much infection prevention as possible. And so the great majority of office visits were via telehealth. But chronic illnesses don't go away, and they shouldn't go unchecked for long periods of time. And so one of the things that we've been doing the past several weeks is proactively reaching out to our patients and calling them and just checking in to see how they're doing. And through these calls, we learned how hesitant people were to come in, and some patients didn't even realize that we were open. So we were able to book a lot of appointments that otherwise might not have occurred. And so through this, we have definitely learned the importance of increasing how we're communicating to the public and to our patients that we're here. Please don't wait to seek care, even with shelter in place, because we can take care of you in a safe manner. And then in addition, while we haven't been doing a lot of routine physicals, there's certain preventive care that's important to maintain. And so we have been keeping up with administering all the adult and pediatric immunizations, to just keep people on schedule with those and make sure that we are ensuring their safety that way. So now we are pivoting, and we're really looking at pursuing a resumption of services. As I said, we're doing this very gradually, very cautiously. You've probably heard reference to the dimmer switch, and that's an analogy I like to use because it shows or hopefully communicates that how quickly we need to be able to adjust. So right now we are turning that dimmer switch up, and we are looking at increasing and have been increasing surgeries and procedures at the hospital. We've added some outpatient services that were pretty much closed. So imaging, in terms of x-rays, ultrasounds, physical therapy, rehab, some non-invasive cardiology, pulmonary and GI endoscopies. So really just gradually opening those up, still for the patients where it's indicated and needed. We're still not pursuing totally elective types of things because that's just not where we're at yet on the dimmer switch. And then we are also increasing our availability of in-person office visits. So I said earlier that we were trying as much as possible to use telephone and video, and we will continue to do that, but there are just certain visits where the doctor needs to see the patient or the patient really wants to be able to see the doctor, and so we are now increasing the ability to take care of patients in person. And we can go to the next slide. So all of this is being done with safety as our main concern, and we assume it's your main concern. And so these are the various ways that we're protecting not only our patients, but also our staff. So in keeping with social distancing, we are maintaining separation of patients in certain areas. So I mentioned that we have respiratory urgent care that is separate, physically separate from standard urgent care and from our doctors' offices. In our facilities, we are rearranging furniture and making sure that the reception areas are, the seating areas are spread out to keep the social distancing in place. We're trying very hard not to have lines, either upon entering the building or for registration. But when we do have lines, there's markers to keep people apart. And then I hope it goes without saying that we are cleaning and disinfecting on a regular basis and really doing that in a deep and thorough manner, making sure elevator buttons and handrails and doorknobs and all the places that are high-touch surfaces are being kept very clean. We are doing temperature and symptom screening at our entrances. So when one arrives to any of our doctor's offices or the outpatient centers, people are asked screening questions, temperatures are taken, masks are issued, and if there's any positive finding from that, then we would take the individual aside, and if they're a patient, we would obviously not turn them away, but we would make sure that we get them to the right place of care. Universal masking is in place, and then a step that perhaps is not so popular but necessary is really restricting our visitors. So there's some very strict rules at the hospital setting. And in the outpatient setting, we know that certain pediatric patients, some elderly, just individuals who may need assistance, really need somebody to accompany them. And so, of course, we would allow for that. We're just trying to keep it to one individual per patient. And we can go to the next slide. So these are just some things that you can expect when you're seeking care at John Muir Health. In our primary specialty care and urgent care sites, we are not currently taking walk-in patients, and we've also we've disabled online scheduling. So this is not to say that we would turn somebody away. If a patient showed up without an appointment, we would certainly talk with them, do the screening, and make sure that we get them to the right place of care. But we are really trying to limit that so that we can control it better. And so the best way to be seen is to really call us in advance to make an appointment or to seek advice. And we will talk to the patients on the phone. We will determine what care is needed and then make sure that they are booked at the appropriate site. As far as online scheduling goes, it's been a wonderful convenience. The challenge with that is that we can't always screen people as carefully as we would like to. So we are exploring some tools that we could implement online to return to providing that convenience. But for now, with our safety first mantra, it's really best that we speak with patients before an appointment is booked. And then, as I said, we're continuing to do visits via telephone and video when appropriate, but also bring people in. And then for emergency care over at the emergency departments, all patients will receive a mask. Their hands are sanitized upon entry to the ER. We do that in our outpatient offices as well. And then we have dedicated isolation rooms, which are reserved for any patients with respiratory symptoms. And then the last slide. So we certainly hope that you're at home more than you're at John Muir, and we encourage you to stay home as much as you can right now. I'm sure people are tired of hearing about washing your hands and cleaning the surfaces, but it really is the #1 infection prevention technique. So we need to continue to do that. And then certainly if there's any symptoms that concern you, we want you to call us. And I know it can be confusing. Some of these symptoms are, can also be associated with allergies or maybe just a mild cold, but in the interest of being safe rather than sorry, if there's any concerns whatsoever, call your doctor, call our urgent care center, and we will be sure to take care of you. And if you must go out, continue to wear your masks, keep a safe distance between you and others. So I've, run through this rather quickly. I know we're going to have a Q&A time. Be happy to answer questions at that time, but it's really just a privilege to be here this morning with all of you, and I do hope this finds everybody healthy and safe.
Thank you, Shelley.
So thank you very much.
Yeah, what we'll do is we'll have everybody kind of go through, and then at the end, we'll kind of do a little wrap up with the panel and questions for the panel. So thank you for that. Next up, Marty is from Kaiser. He's the Senior Vice President for the Diablo service area for Kaiser Permanente. So Marty, you want to go ahead and get started?
Thank you, Mayor McGallian, for convening this meeting. We understand that many people in our communities are concerned about COVID-19, and we want to share what Kaiser Permanente's actions are in response to this rapidly evolving situation. As our national, state, and local leaders plan to reopen non-essential businesses and restart our economy, we remind our members, staff, and others that COVID-19 is still very present in our community. Kaiser Permanente's highest priority remains the safety of our employees, members, and the communities we serve. And as we continue our response to COVID-19, we're meeting our members and patients' most critical care needs while initiating a phased approach to resuming our full medical office operations. We're encouraging Kaiser Permanente members who have symptoms of respiratory illness to call the number for the 24-hour health advice on the back of their Kaiser Permanente membership card. No matter your health needs, you have many safe ways to get care. If you need care, please do not delay contacting us. Delaying care can result in longer-term health issues. Members may seek care by calling 1-866-454-8855 or visiting kp.org. We also want to remind you that our Walnut Creek and Antioch Medical Center emergency departments are open for those who need immediate care. For non-urgent care, we have shifted most outpatient visits to virtual care appointments and are emphasizing mail order or curbside pharmacy services. In fact, more than 80% of our visits system-wide are now phone and video visits with a clinician, and mail order prescriptions usage has nearly doubled. We've implemented numerous safety measures to ensure that staff and members are safe. Staff have been advised to follow CDC protocols for the coronavirus, and when you visit any of our campuses, you'll notice things may be a little bit different. If you need to visit us in person, we have many safety protocols in place to protect your health. Each facility has a single point of entry, and we've implemented rigorous temperature checkpoints. If you're found to have an elevated temperature, you'll be referred to a separate consult area where you'll be provided directions to receiving appropriate care. In order to limit the possibility of exposure, we are limiting visitors in accordance with state guidelines. I also want to note that moving forward, care may look a little bit different. Our employees are thinking outside of the box and are finding new ways to meet our members' healthcare needs. And I'd like to share one of these ways with all of you. At our Antioch Medical Center, the staff and pediatrics brainstormed how to ensure that our most at-risk pediatric patients could continue to receive immunizations during this time while decreasing their foot traffic in our facilities. So they came up with this idea, and they brought it through to their department and site leaders and proposed a workflow that was modeled after a drive-through testing for the coronavirus 19. This led to a pilot program at the Antioch Medical Center, and the feedback we've received from our members so far has been very positive. This type of innovation continues to shape our delivery of care. In closing, I wanted to commend the hard work of all of our first responders and frontline workers in our hospitals and throughout our communities for their commitment. I want to thank the people of Concord and the Greater Bay Area for doing their part, staying home, and following social distancing guidelines. So I'm happy to participate in further questions later, but at this point, I'll turn it back to you, Mayor.
All right. Thanks so much, Marty. We appreciate that. And so next up, we have Dr. Michael Miklich. He is an orthopedic surgeon from Muir Orthopedic Specialists here in Walnut Creek and Concord. And so, Dr. Miklich, go ahead.
Thank you for having me, Mr. Mayor. And this is kind of a little bit of a perspective and kind of my own experience as we've progressed through these last few months. Our offices, as you can see listed here, currently are contracted into our larger Walnut Creek office and our Brentwood office, with plans in the coming months to return to all of our facilities. But of course, everything we do each day now is a little bit different, as both Shelley and Marty have noted. Everything from screening patients as they make appointments, how patients are screened when they come into the office. Most of what we do day to day, we still, as clinicians, follow the teachings of Dr. Semmelweis. This is, for your historical perspective, an Austrian doctor who was the first pioneer understanding aseptic technique. So he taught us how to wash our hands, and that's what we still concentrate on. I'll talk a little bit about kind of what we've done. Obviously, gravity still wins in orthopedics, and that leads sometimes to things like fractures, acute tendon injuries, and things like that. Our office has been able to provide those urgent care needs. Things of that nature sometimes have needed urgent surgical management, and we've been able to provide those services as well. But we also have done a significant pivot in terms of how we care for our patients. Today I'll talk a little bit about how we're utilizing telehealth Obviously, if you end up with unfortunate mountain bike injury, you're going to want to have care for that clavicle fracture, and the need to see someone in person and have appropriate radiographic evaluation and hands-on physical examination is still unparalleled. But out of necessity, when all of a sudden there was significant sheltering in place happening, we as clinicians needed to still be in touch with some of our patients, whether it was a post-operative follow-up to find out how that range of motion was progressing for someone's shoulder that had been operated on a couple months ago, or even to find out what we could do for some patients that had been expecting to have some physical therapy, patients that were going to try to go without surgery for a problem, or patients that had upcoming surgery planned. So if you would have asked me initially, I would have said this is almost impossible to provide musculoskeletal care for someone when a lot of people, myself included, really you weigh a lot of value on a physical examination of having someone's evaluation of a body part. But then I sat back as we progressed into making these links with people. People became, if they weren't already, very adept at Zoom meetings. We've utilized assistance from nursing home staff to help elderly patient meet up with us when they've been deemed too much risk to get out of their shelter in place. And the thing that we found was that, hey, we can provide a fair amount of self-directed assistance when we're talking about an examination, but also as clinicians, historically it's been said that about 90% of your diagnosis comes from what you hear, what you understand, what you find in a history, and knowing someone's risks for this, that, or the other injury. So I kind of found that I equate it to what I would historically have called cocktail orthopedics, where you're in a social situation as an orthopedist. What questions do I get? Where either introduced to somebody or having known someone and they have a musculoskeletal complaint. You're in a social setting, and guess what? I get asked about those problems of someone's knee or someone's shoulder, and at that time you don't ask them to slip out of their slacks and have their knee examined, but you do a fair amount of interpretation of their problem, and realize that we actually are very adept at screening for things. We can provide a significant amount of counseling. We even now have abilities to link up a patient with physical therapy through TELE-REHAB. We have the ability to do a lot of our follow-ups. We can follow up with someone after a MRI and provide ability to go over an MRI findings with the patient online. And also, it's a very critical tool for screening when someone has the fear that they maybe can't come and see us in person, which the shift is in place now. We see more people comfortable to come out, put their mask on, come into the office and have a traditional examination. But we also find this is a very safe screening device. It may be something where a patient, they themselves don't have the experience to tell themselves or tell their family member that, hey, this is going to be something that we can watch for a while. This is something that doesn't need quick, prompt musculoskeletal care. Those that might need it, yes, then we'll filter you into our offices and safely examine you there. Yeah, this is something that from 9 weeks ago until now, I think that all of us as a community are becoming much more adept at our online meeting skills in terms of what we have been able to do with patients. Directed exam, me directing them where to place their hands, what motions I should ask them to do, ways to duplicate things that might be a resisted force on their exam. And so we're becoming very adept at this. And I think in the future, we'll even see this as a part of musculoskeletal care. Historically, I think of telehealth, and I think immediately of a cold winter in Alaska where someone is receiving telehealth visit and care from a physician maybe 100 miles away from them. But this may be something that allows us as specialists to meet up with someone a little more distant from us and solve problems. People that might have work schedules that have previously prevented them from coming in during normal office hours to have a problem evaluated. And simply maybe someone who's a little more lazy and they just can't quite fit it into their schedule. So, yeah, this is something that we've had a lot of good feedback with. As you can see on this slide here, this is a colleague, Dr. Chang, the screenshot where he's explaining some spinal pathology to a patient on an MRI review. And we're becoming rather adept at showing the pathology and getting people to understand what's going on with them as we do these reviews. This is something where I think, as Shelley had mentioned, and Marty had also agreed, that the concept is now, let's not neglect our own health out of kind of fear of the situation of COVID that it provides. This is a great, excellent way to still provide care for those who may need to have more extended protection or isolation from the rest of the community.
All right. Well, hey, thank you so much, Dr. Mikulich. And I know there's probably a few questions that we'll be asking after that. We appreciate your perspective for sure. So I know this has been one of those things where you guys have had to really figure this out on the fly.
Exactly.
All right. Next up, Dr. David Brothers and Courtney Brothers. So they are from Cosmetic and Family Dentistry of Concord. So David, thank you for joining us. Oh, hold on. You are muted. Let's unmute you. Go ahead. Perfect.
Can you hear me now?
Yes, we can.
Hey, how's it going? It's good to see you all, and it's very interesting that we're at the time that we're living in right now. It's one of the funny things is that there are some things that's changed, but a lot of it's, you know, been sort of the same over the years. We've always been in, you know, from the physicians as well as dentists, the forefront of, you know, keeping things clean and disinfected and all that stuff. So the nice thing is there may be some new armamentarium that we have and everything like that, but overall, we've always been there doing these same things. So the good thing is that we as healthcare providers are doing what we can to make sure that we keep you guys safe and our families safe. So everything we do is not only for us, but for you, and make sure we take care of everybody. Courtney's got a lot of things that we can go over here that we're going to do differently.
It's a really good point, because many of our, you know, sometimes hear, you know, ooh, is it safe to go to the dental office? We have implemented some things, which I'll go through, but it is if you're going to want to be anywhere, it would be a, you know, a healthcare facility that, you know, is just very sterile and cleaned, you know, to the highest standard. So that part is something for patients to relax about. So like the other healthcare providers who have presented this morning, we have basically implemented the same standards, which have come down from the CDC and other organizations, including the American Dental Association, following, you know, those guidelines. So we're doing the screening of patients on the phone before even making an appointment. So the COVID-19 screening, and in our case, we're either doing it over the phone if somebody prefers, or texting or emailing a document. They'll check it off, send it right back to our software system, and they're good to go. Then upon arrival, another check again, along with the contactless temperature check. The idea being that anybody who's in our office will have been, you know, checked as many times as we could, and obviously the staff as well every day. The one thing that's kind of unique that we are offering is when patients arrive, they can text us or call us and stay in the car in case. We usually, frankly, don't really run behind, but this way we're really trying to minimize how many people are in the waiting area. As a matter of fact, our goal is that nobody will really be there. So, you know, if somebody happens to time their drive so they're early, rather than hanging around in the office and having lots of people, our protocol now is you just wait in the parking garage in your car, text us, and as soon as everything is clear and there's nobody else that you can be bumping into, we'll text you and you pop on up. So it makes it feel real safe and relaxed, and we've had really good feedback from that idea going forth. Of course, the hand sanitizer upon arrival, masks, universal masking in for us behind the front office, and a lot less paper going back and forth. We've pretty much been a paperless office for several years, but we just made the switch over the past like so many dental offices, we've all have a lot of colleagues. We're all in the same sort of boat for the past 2 months. We've just all been trying to figure out what are the best protocols that can make things safe for patients and comfortable for patients. And so we, like others, have implemented contactless payment, paying in advance, paying online, and then also the consent forms and things like that, rather than handing over a piece of paper. Having those are now finally paperless as well. The picture that you've got there, these pictures is kind of like how it was. In our office, we're going to have sort of a glass partition between where we are and where patients would be. But, it just, so people feel safer. And then on the next slide, it's got a couple of points about our goal is to, as we said, have almost nobody in the reception. These photos are the way it was. So you can see there's several chairs together. Our office now, we have, unfortunately, we've gotten rid of the magazines. If you walk in, there's no magazines.
Actually, we will have magazines actually in our office, but what we will do is, if you have one that you want, we'll bring it to you and then you can take that home with you. So it'll be a gift from us to you. Yeah,
so. And that's the way dental offices, we're all in the same boat, and we all just want people to feel comfortable, feel relaxed, and to get on in and take care of their dental needs. And so that's the kind of thing that in our industry, we've heard a lot of people are doing going forward. So our reception now does not have those 6 chairs. It has, from this view, you could only see 2 chairs, and they're both, I think when I measured it way back when, it's maybe 8 feet apart. And there's a 3rd chair. Again, we don't expect people to be sitting in it.
But every once in a while, might be a caregiver with the person. So we want to make sure that we have those spaces for those people.
Yes.
So, but ideally, we are going to try to have as few people in the office as possible.
Yeah, we're gonna encourage, as many of you might have the same experience, dental offices can sometimes be a real social bonding. We've got many patients who've been with us for generations and generations, and we look forward to them coming in, and we want to see their photos, and we want to hear about their family, and I think it's vice versa. So the big change for us, and I think many dental offices, is at least in the beginning, we're going to sort of have to try and minimize that. And so when doing the phone screening, sort of say, hey, we love you, can't wait to see you, but we're going to sort of do your visit will probably be quicker. So it's actually an advantage for visiting the dentist now. We're not all going to, he won't be jibber jabbering, and maybe the same with all the other dentists. So toy chest is another difference. You might want to have kids prepared. They're not going to be digging around in the toy chest picking their prize. What we've done in our office is taking the toys and put them up on a board, and a child would say, oh, I want that one or that one, then we'll go in the back and get that for them. Different protective gear, different levels of protective gear. The clinical staff will be wearing masks according to the procedures. The gowns will be, instead of the white jacket as seen in the photo there, Dr. Brothers will now be wearing a sort of a longer gown that's a little bit more covered up, and the face shields that you've seen all over town, we'll be implementing those. And air purifiers we've added just to sort of go above and beyond. A peroxide rinse, just a little rinse. Don't let the word scare you. It's just an extra precaution. Things like the candy jar that, office is sugar-free. Things like that just won't be out, or a pen, we're not going to hand you a pen and expect you to hand it back and just be sitting out in the office. That's the kind of thing, if you do have to touch something, you're going to take it home. We've, actually bought a bunch of pens. So, little things like that, the little things are what make the difference for sort of germ control and, people's experiences. So we really want to make sure patients know that they're going to be in a really, safe environment. And we've been making all these precautions and preparations for the past couple of months.
And we'll always let you know that we are there for you now. We are
Mhm.
open. We are seeing patients and things like that. We are doing stuff to make sure that everyone is safe and everyone's health stays good, and through especially this time that we're dealing with. But everything is going forward, and we will all do our best to take care of your health needs.
We'll all get through this together. Dental offices, because we're all small businesses, we don't have these huge resources like the wonderful presenters who came before us. Most of us are small businesses and family run. So we've really reached out and consulted with each other on how can we best serve our patients. So I'm sure your dental offices have probably implemented very similar protocols to us. We're all just trying to keep things as best as possible. We just really want people to start getting in as soon as they can, because we fear that people may have neglected their dental health, especially kids, if they've been home for a few months and not going out, and or other people, which is no problem. We just want to make sure people finally feel comfortable we're now Concord is open. We'd love to start taking care of people.
All right. Well, thank you so much. We appreciate that. And thank you to our panel to kind of go through, and you can see that the two major hospitals have taken a lot of precautions. The goal is to really try to make sure that people understand that it's still safe to do so and don't wait. Dr. Miklich pointed out that you're still going to have a number of injuries and things are going to happen, and please continue to access care. And they've taken every precaution, just like the smaller dentist office. Everyone has had an opportunity to take precautions to make sure that you're as safe as possible, but at the same time, if you have an injury, let's make sure it's not worse than it needs to be, and let's not all of a sudden turn it into something that becomes life-threatening because you were concerned about something that you may be getting in a hospital, when in some cases the hospital is one of the safest places you could be, or one of these care facilities. So I know there's been a number of questions that have come up. I believe, Shelley, you actually got a few questions that I don't necessarily were in the chat, but I believe wanted to bring up as they were coming in.
Sure.
And then I'll ask kind of the team to go ahead and bring up a few questions as you're seeing them so we can go through that. So Shelley, you want to go ahead and go through that?
Sure. So I believe one of the questions had to do with the capacity currently at our hospitals, Concord and Walnut Creek, and it's really quite good right now. COVID-19 patients represent about 3% of our total capacity. So this is enabling us to increase our services daily. We're keeping a very close eye on that capacity, staffing, and of course, PPE. And then we had another question about whether we have any plans to expand our mobile testing to the business parks. And so I would say right now, no, because of the relatively limited supply or resources, we are focused on testing for our symptomatic patients, our patients who are scheduled for surgeries and procedures, and then of course any staff or physicians who've had exposure. But expansion of testing is a daily topic. And we also have been working with some of the businesses to teach them how to do temperature and screening at their places of work. And
let me jump in here as well.
that, yeah.
And I wouldn't mind actually around those same lines. Marty, do you mind kind of giving us a rundown of what's going on over at Kaiser right now, as well as it relates to inpatient care, hospital, how many people are in the hospital, kind of like what's going on at John Muir?
Yeah, absolutely. We are also seeing lower than the normal hospital volume, lower than normal emergency department volume, although that has been picking up lately. And we're able to effectively screen and triage patients with respiratory symptoms, and in essence have a workflow that allows very limited risk of exposure to those that are coming in to minimize any danger for folks that are coming in and cross kind of exposure in the emergency departments. But overall, and we're seeing the number of COVID admissions decline over the Bay Area, in particular in the Diablo service area, down to the lowest points we've had in many weeks. So that's encouraging. I would also mention that the hospital systems are working collaboratively across the Bay Area and the Diablo service area to make sure that we're screening, monitoring, and working with skilled nursing facilities, assisted living facilities, extended care facilities, to monitor and screen both workers and residents and patients, to make sure if there is someone who tests positive, that we have preventative measures in place to decrease the risk of a large-scale outbreak. So we're working very closely with the Department of Health and with the other systems to ensure that we're taking care of the most vulnerable of our senior population.
Okay, and one of the things came up. I know there was questions around testing. In a slide just after we break from here, I do have some testing information around what's going on. There was another question around, are there any other testing sites? So we do have a testing site in Concord. It's off of Bates. I do know that the county is working with Monument Impact currently, and we're going to be setting up another testing site at the Monument Impact office as well. And we're looking to do some additional drive-through testing sites that we're trying to work with the county over the course of the next few weeks as well. So those things are going to be rolling out more and more. But I believe too that, of course, if you are still accessing your primary care physician, or if you come into the hospital, those type of tests also can be done with your current primary care physician. Is that correct? Shelley or Marty?
Yes, in Kaiser Permanente, we would have our members call the advice and appointment call center, and they would be directed to the appropriate testing facility, whether that's a medical office building close to them, or if there's an emergent need, it would be directed to an emergency department. And we have a variety of different testing capabilities.
Got it. Shelley, is that very similar on there as well?
Yes, definitely. And we have the 2 mobile testing units, one in Walnut Creek and one in Brentwood, and then of course doing it in our urgent cares, respiratory urgent cares.
Okay. All right. So we had Shelley, there were a few other questions that came in to you as well, or was that most of the ones that came in?
I think I covered everything that's come in, unless you think I haven't.
No, I was just checking. I just wanted to make sure.
Yeah, I think so.
Because I think a few people kind of sent you a Zoom privately, so I just want to make sure. And then Valerie, did you have a chance? Are there a few that you've had a chance to read through?
Yes, I have one from Wayne, who is interested in understanding for the Doctor Brothers what kind of air filters are being used, whether they're HEPA or ozone, and particularly concerned because he's allergic to ozone.
Oh, hold on, you guys are muted. There you go.
Go ahead.
We're doing a lot of HEPA stuff now, and that should help with that. We do find there's a lot of patients with the ozone allergy, so that's one of the things that we're dealing with. And right now we're going through as much research as we can to find out what's the best for everybody.
If there's something else, there hasn't been. In fact, the American Dental Association right now, they did not. They're sort of putting it out as they're not even recommending to get some sort of an air purifier. Yeah, but we know. We just wanted to go ahead and get something.
I think sometimes it's just better to go a little bit above and beyond what is called for, just to get,
do everything we possibly can. Even if the research is out, we'll just, put something in place that's, that won't harm patients.
Okay. All right. Thank you.
Next
Valerie?
question I had, Tim, was for Kaiser, and it really has to do with ADA access to the hospital. Again, this also came from Wayne. It says that the ER parking lot at the Walnut Creek campus is sealed off and the closest parking is about a quarter mile away. So how do they assure that disabled people can still have access to the emergency room quickly?
Yeah, so that's a great question and something that we've thought a lot about, access. And so we do have a single point of entry for our hospital and our medical office building in Walnut Creek that's closest to the parking structure for members. In the front of the emergency department, there is drive-up access just outside the emergency department. You'll notice if you're driving past Walnut Creek Medical Center that we do have a couple tents that we put up out in front as a planning should we have a surge related to COVID. Thankfully, we haven't had to use those tents, but we've workflowed those. So there is parking for drop-off parking in the front, right adjacent to the emergency department that allows, and there is a walkway, and we do have security there to help assist folks to make sure with wayfinding. We do expect sometime in the near future we'll return to a little bit of more of a normal emergency department, and we'll open the horseshoe back up to allow for parking there. So apologize for any temporary inconvenience, but there is adequate access there and folks available for wayfinding.
Okay. Thank you for that. And then a few other questions. I saw one, it was directed to on the dental side. Let's see here. In terms of kind of protection for the dental hygienists, making sure that all the proper precautions are being taken. What does that look like?
So I assume other offices are doing it similar to us. With us, what we've done is we've met virtually weekly just by Zoom in the beginning to keep everybody, mentally, together. The past 2 weeks, we've had long Zooms and basically said to our hygienists, both of whom have been with us for more than 15 years, and we love them dearly, we said, what would make you feel comfortable? We're clearly doing all the guidance out there. We're following all the, the rules, but what would make you feel safe to come back to the office? Do you need more time? What kind of gowns do you want? Shall we purchase more instruments so they don't have to be sterilized as often? What are your preferred masks? All those kind of questions. So we've kind of taken the approach that, we've done the research. Our, professionals like the hygienists have done research as well. And so where we're at, and I think most other offices are probably doing it similarly, our staff feels 100% safe to come back. They're happy to come back and excited that even more so than I thought. When we suddenly got the green light that we were open, I thought, oh gosh, let's get our heads around this. I didn't think we would be open while we were still in shelter in place. It kind of threw us all for a little bit of a curveball. But our two hygienists and everybody else was sort of like, okay, what we're doing is perfect. And I mean, there's never perfect, but it's the best there can be, that from all the research we have out there, and they're very comfortable coming back to work.
And we're probably in for a little while limiting as much ultrasonic scaling as in the past. So creating less aerosol until we get everything under control. So in the past, we've always used ultrasonic to help do bulk cleanings and things like that, and it created a lot of aerosol, and that's probably the last thing we as an office should be doing at this point. So
Right.
we aren't doing as much of that. So we're pretty much limiting that, altogether.
So what that means is, like, when you go and get your cleaning, and it'll be harder work for the hygienist, I think, right? They'll have to physically use more energy rather than just sort of like going with a ultrasonic, but it creates less aerosol and makes everybody feel more comfortable. So that's what we've implemented.
Perfect. All right. Thank you for addressing. I know that was actually those are definitely some of the questions that came up. Did I miss any other questions, Valerie or Melissa? Okay. Well, thank you so much. I appreciate everybody that was a part of our panel today. Again, like we mentioned, the goal is just to make everybody aware that healthcare is open. Please do not be afraid to access healthcare. We've got some great healthcare providers in our area. We're very, very fortunate with having John Muir and Kaiser, Muir orthopedic specialists, and some very, very good dentists in Cosmetic and Family Dentistry of Concord. And so thank you for sharing your perspectives and the different things that are going on, and also being creative in terms of the telemedicine piece. I know that some places have kind of used it in the past, so some of you had an opportunity to kind of figure this out a little bit before this happened, but it's definitely forced everybody to think differently in terms of how you can access care. So thank you for that, and we'll go ahead and move on to, we'll go ahead and kind of move on to some other things at this time. So thank you so much. We appreciate your time this morning. Okay.
Thank you.
Thank you.
Thank you.
All right. So let's go ahead, and I've got just a few more slides I wanted to just go through with everybody. And of course, just continuing to remind everyone of the different resources that are available on the City of Concord website. Please go there. We've got a number of different things, whether it be the business resources and economic development, or housing and social services, for any COVID-related information. We're trying to make that, we're really trying our best to make sure that the most up-to-date information is available, including health orders and things that are linked in that regards. What I will tell you is we're going to go ahead and we'll have, I've seen a number of other questions that have come in. So just to give you a heads up, we'll go ahead and kind of take those as we go after some of the slide presentation pieces. We did talk about this earlier in terms of drive-through testing is now available. This is the location. Here is, if you would like, you can call for appointments. It's Monday through Friday from 8 to 3:30. We did mention, though, that a second testing site is going to be set up, specifically working with Monument Impact. It is going to be a walk-in test site location at this time, just because, you know, we do have a drive-through testing location, but we wanted to make sure that there was an actual walk-up testing place available as well. And again, an additional testing site is in the process of being set up that will be a drive-through location, probably off of Monument Boulevard somewhere. Hopefully over the course of the next week or two, we'll have more information on that as well. So just wanted to make sure everyone is aware of that. Of course, the constant reminder in terms of wearing some kind of mask. Again, it does not need to be a medical mask. It could be as simple as some type of cloth or bandana. And it is our general guideline at this point in time. But the goal is not to smother you or make it some kind of health concern. I know there's been questions about wearing a very, very specific type of mask, but sometimes it can be less formal than that, just to make sure that everyone's still aware of that. I like to continue to make sure that we highlight our Concord restaurants, and thank you to those Concord restaurants that are doing their best to keep their doors open, but please help them out. Concord Eats, if you go to the City of Concord website, Chamber, or to the Visit Concord website, has all the available restaurants, whether it be Eats or Treats at this time, let you know they're open, and please take an opportunity to patronize our restaurants in the local area. Continue to let people know about our Concord Cares program, even though the governor did still talk about trying to set up a program. Our program has been running at this point for the last 9 weeks. We have over 100 or so families that are individuals that are receiving services. This is for food or any helping hands program, and it is still available. It will continue to go through shelter in place. And it is something that is still available. So if you'd like to sign up for that, please go online and do so. Continue to let people know about the Concord Community Foundation. And this is something that We have raised over $5,500 over the last few weeks for this. These are going to go towards helping some of the supportive services that the city of Concord has set up. And so those monies are actually going to be donated over the course of the next few days. Kind of the first round of monies are going to be donated, and we've got some places for that those funds will help. And then finally, just a constant reminder about, we do have emergency food resources that are available through the Monument Crisis Center. Every Monday and Tuesday, food resources are available to those community members that may need those may need any kind of food resources. Park Haven Community Church, also located 1187 Meadow Lane, every Tuesday. And I don't have a slide for it, but just a constant reminder that every 2 weeks, the 4 Catholic churches in Concord via the food bank in St. Vincent de Paul also set up on Tuesday, Wednesday, and Thursday. We just finished that this last week. Again, when you see those little things come out, please, if you don't mind sharing those out to members of our community. A lot of people are taking advantage of those resources, and we're trying to make sure those get out to the community. Emergency food resources, grab and go. They continue to be available at a number of our sites, our school sites, Clayton Valley High School, and then a number of places around Mount Dalby Unified School District. And so with that, again, on behalf of Visit Concord and the Chamber and the city, take care. And of course, we do miss you. So thank you for everybody who's doing your part during this time. And I'd be remiss if I didn't at least continue to remind you about the Eye of Diablo, the beacon lighting that happens every Sunday while we are sheltering in place. So with that, of course, I am going to go ahead and open it up. I know we had a number of questions that came in. So what I'm going to do is I'm going to unmute the audio, and I think everybody actually may need to remute some of yourselves. Just for all intents and purposes. What we'll do, though, is if I know there's a number of questions that have come in via chat, but those who are on the Zoom, if you want to go ahead and if you've got some questions right off the bat, we can go ahead and answer, and then I'll go ahead and take some of the written questions as they go in, as they come in. So if someone would like to, who wants to, and if you want to go ahead and kind of use the raise your hand feature on Zoom, please go ahead and do so. If not, I can also.
Jim, I should point out that I think it was George Fulmer said that the raise your hand feature is no longer there. They'd have to use one of the clapping hands or the thumbs up or something.
Got it. Okay. So if that's the case, just use maybe the thumbs up feature at this point. If you'd like to get called on, we can do the. So I see, is it Lance? Let me go ahead and unmute Lance. Lance, you had a question?
Yeah, it comes with a little bit of background, so I hope you'll forgive the amount of information in this, but let me just go ahead and read my question because it sets the tone for it. So I'm a resident of Concord and on Dinkinger Road, and so my question is regarding the road work that's being done on Dinkinger Road. And as a little background, you know that Dinkinger Road is a major thoroughfare beginning where Treat Boulevard ends, and it connects traffic between 3 of Concord's busiest boulevards, Treat Boulevard, Clayton Way, and Concord Boulevard, with at least 4 schools nearby, and there's 2 parks, 2 public pools. We have Highway 4 access over Bailey Road and Landana, 2 large neighborhoods on either side, as well as providing access to Safeway, Food Max, Ace Hardware, multiple care homes and skilled nursing facilities, as well as many restaurants and businesses. Though the speed limit is posted at 25 miles an hour, traffic routinely is 35 to 40 miles an hour and above, without even a center turn lane, or what should really be 2 lanes in each direction. One resident pulling out of their driveway is all it takes to stop traffic and create a hazardous condition on Dinkinger Road. The road itself is full of potholes, uneven pavement, and is simply in the most appalling condition. The canal has not been connected, functioning part of the canal system for approximately 30 years. There's room enough for at least a center turn lane, and the type of walkway improvements that were done along Bailey Road, or possibly even an additional lane in each direction. So I realize this is a very complicated issue, so perhaps you can let us know, myself and a few of our neighbors, why isn't the dead canal being removed, Dinkinger Road being improved, and proper sidewalks installed? I'll turn it back over to you. Thank you.
Okay, and I know I've got our city manager as well, and she could probably help go through some of that. We know we had to do full reclamation, of course, to Dinkinger Road, and there definitely was some issues and concerns around even having to deal with the utilities and PG&E, and a little bit was the actual true widening of the roadway and trying, like you said, kind of that canal component is definitely there. But Valerie, do you want to also comment on?
Well, so the good news is that Deckinger Road is in the beginning stages of repair. I was going to post the engineer who's working on its name and email address, Lance, so you can email him directly with your questions and start a conversation with him. I don't know the status of the canal, so I don't have the ability to answer your question in more detail right now, but we can get you in touch with the right people.
Mm-hmm. Yeah, and that's something too that, again, I know that in terms of us widening it was more the biggest issue as well, dealing with utilities, you know, and I don't believe we don't own the canal as well, so there's a lot of issues around that too.
Well, I know we don't own the canal, but I don't even, so it's a complicated question. He's correct. And the good news is there will be road work being done very shortly on Deckinger, and you can get information on it by going to the city's webpage, where we have a CIP, which is a capital improvement plan interface, where you can either look projects up by name, or you can look at a map and click on the dot for the area you're interested in, find out what the project is and what's going on, and the city contact. Mm-hmm. All intended to make it easy for you to follow up on your questions with the staff involved. But I'll post in the chat line. It's Ali who is the engineer working on this, but I'll post his email in the chat line to make it even easier for you.
Okay. And sorry we couldn't answer all of that, Lance. If you want, don't hesitate to contact me offline, and we can even chat after, just to kind of go through some follow-up. Did you have any other question or? Oh, you're muted.
Thank you. Yes, I appreciate all of your comments, and I will reach out to that engineer. We have reached out a couple of times in the past as we heard that this project was coming up. So this is not our first contact, my wife and I.
Okay.
And so far, our response has just been about the complications, but not about any sort of resolve to go forward. Mm-hmm. We know that this land is owned by the Bureau of Land Reclamation, so we understand that that's a complication. We know that the Concord Water District has the administrative rights. They've been given grantee rights to administer this land, and also they are the ones tasked with maintaining it. So it's a complex environment, we know, but we as residents along here have been dealing with this issue, we feel, long enough. And we're hoping that some extra attention can be given to it. That's why I took the time to lay out the sort of environment as much as I did, to show that this is clearly something that's worthy of attention at this time. So thank you for your time, and we can continue offline as you suggest.
Yeah, thank you, Lance. Okay. All right. On the call specifically, any other questions or? I mean, I know we've had a number of questions on chat, so I can go through some of those. Let's see here. Let me kind of. Okay, and I know Dave, you had a question as well. I don't know if you mind you want to ask, because I don't want to get it lost in the chat here as I'm trying to scroll through some of these. I apologize. Okay, so, are you on? Do I have to unmute you? Oh, that's weird. There it goes. Okay.
Cool. Thanks, Tim. Yeah, there's been a bit of conversation, both in the Zoom chat and mostly on the Facebook live stream, about homelessness. And it's a very complicated issue. There's thousands of questions right now, and there's a little bit of confusion out there. We've been talking about it, Concord Communities Alliance, and through Listen Up Concord. I know you're not going to be able to have all of the answers, but if you can help to clarify some of the confusion that's out there about what the city's doing through PD with regard to disrupting camps, et cetera. We just got word that, I don't know the details, but a woman, unsheltered woman, died last night, and she was denied health when she tried to get it. Again, allegedly, I don't know the story.
Yeah.
But the community is really concerned. We CCF was set up to help out folks like this, and we need to also have a big open dialogue about it. So if you want to get the ball rolling on that,
yeah, no, thank you for that. And I think I know we've talked in the past as well, and I think it'd be safe to say that it'd probably be good for us to have just a separate forum, just to have a little bit more open dialogue. And I'd love to actually get even some of, we'll get someone from PD, we'll get someone from county, from health, that type of thing, just to kind of complete the big picture so that we can better dive into the different things that are happening and why they're happening. Because I think that it's been pretty clear that over the last last month or two, there's been a lot of questions, of course, that have come up around our unsheltered populations, what's going on with them, if we're displacing a camp, or, why are we specifically not necessarily targeting that camp, but why are we paying attention to moving those people on? And I think we've been trying to do everything we can to communicate that out to you, to kind of show, okay, if we moved to camp, why did we do it? And there's always been a very specific correlation between some type of action that has come as a result of that camp, not just that, those happen to be homeless people who were, living in a particular location, and, nothing was happening as a result of them being there, and there was no disruption happening. And I think that's been the piece that has not necessarily, we're trying our best to try to communicate that out, that says, look, we're not disturbing camps that are kind of, hey, if they're off the radar and there's no other things happening as a result of the camp, that's fine. But when there is crime and public safety direct issues that are directly happening as a result of those camps, which has been the case every single time, and that's been the piece that we've been trying to share, is that when that is the case, that is the point where our PD will take action in the interest of public safety. So that's the part where, when it's in the interest of public safety, we will take action. When it's something that if nothing is happening as a result, we're more than happy to leave that camp right where it is. And I know there's even been talk about trying to make sure that that kind of word is shared, that says, look, if we're not having people that are causing harm to the adjacent neighborhoods, or causing harm to the adjacent businesses and those type of things, that's fine. They can, we're not going to move them on.
Well, that's very reassuring to hear you publicly say.
Yeah, and that's what I want to make sure everybody understands, is that is the case. That is what we're trying to operate under. We're going to follow those guidelines, because those people don't need to be moved on, and we haven't. Those that there have been no concerns or issues with, we've not moved on. But those that there's definitely been specific issues or concerns. Now, of course, there might be a one-off where it happens where a single person that's in a camp is getting affected by the overall larger camp. And so, yes, those type of situations are going to happen. And so that might be something to where, our police department, and we don't have a health department, of course. So a lot of this is also us handing a lot of stuff off to county health and doing our best to kind of work as best as we can, but it's not necessarily the entire job of our police department to kind of manage what is going on with our homeless population. And so that's where we've even talked, I've talked with you and a few others to say, maybe there are going to need to be some other organizations to help step in to help these people better understand, how to make things work during this time. And so that's where I kind of, look to you guys and say, hey, are there connecting points that we can help people better understand, so that we don't keep having kind of these gaps in communication of understanding why people are getting moved on.
Yeah, I think that's great, and I think that I very much welcome your idea to have a forum, a public forum dedicated to this, and with PD involved and the community involved, and take all of the questions and just put everything in daylight, and let's just talk about this so we're all as a community on the same page.
Yeah, because I think it's one of those, genuinely, people are not trying to disrupt the homeless, and we're trying to make sure that there are services available. But it's one of those, not every single homeless person is the same, and not
Exactly.
everybody wants to take services is the other thing. And so there's a huge disconnect that can occur on when you're dealing with different members of the the homeless or unsheltered population. And so again, not everybody's under that same umbrella, and so even that needs to kind of, let's have a deeper conversation about that. And I think that would be helpful for everybody to fully understand, as well as talk about how we can help more.
It's tempting to launch into a response to part of what you said there, but I out of respect to this, I would much prefer we just kind of go over things that were brought up on this issue through the people that were watching and commenting.
Sure. And thank you for that, Dave. And like I said, I think we'll go ahead and set something up
For sure.
to have a forum here in maybe in the coming week or two.
That sounds great.
It would definitely be helpful for that. I apologize. Valerie, do you have a few that you've seen, or?
There's a question about when Oak Grove starts. And again, I need to look on the city's website to get you a date for that. That's from George. George, you can email me separately and I'll try to get you that date when I'm at work.
Okay.
There was a question about whether we're still sponsoring homeless in hotel rooms as a city program. And that is still going on. I think most people know that the city council dedicated about $110,000 to help house the most vulnerable of our homeless population that did not qualify for the programs that the county was running, focusing primarily on families and getting them into hotel rooms. And that program's been running since for the last few months. And we've now moved into working with a number of nonprofit groups in core, trying to make sure we can transition these individuals into housing, more permanent housing, as the shelter in place ends, as the money that the city set aside is close to used up.
Okay.
I'm trying to see if there's other questions.
There was a question, when will the city reinstate the neighborhood cleanup effort? That is something that I know that we work through, depending on what neighborhood you're in as well. Some of them sometimes will have like dumpster days or those type of things. Those haven't been reinstated yet, just because again, that is considered an event where people have to gather. And so that is something that we're going to bring back up. I know that we were actually supposed to have, actually just a few weeks ago, another event where we do it at the Concord Pavilion, and we'll set up a number of dumpsters specifically at the Concord Pavilion instead of doing something specifically in the neighborhood for the sake of kind of that community cleanup. And that's going to be something that we'll go ahead and chat about again and see if there's a prudent way to do that. I would imagine because everybody's been home and kind of cleaning out, having an opportunity to do a lot of clean out. So that's something that might be timely. And then there has been questions, I do want to bring this up. There has been questions about continuing kind of the moratorium around rent increases and evictions. That's something I just wanted to let everybody know that actually something that the council is looking at. We're in the process of trying to talk with our with city attorney about, because there are some ways that can be done and not be done under the governor's orders. There are certain limitations. There are certain things we can do under the governor's orders, and then outside of that, then it becomes kind of I don't want to say a different animal, it becomes a different piece of legislation. And so that's something that it is being looked into. We are trying to get a better understanding of what can be done moving into the future. The other thing we're trying to do is, we know that there's been a number of conversations at the state level around different types of things as it relates even to landlords, shopping center owners, those type of things. So if there's a better way to kind of get a number of different programs all to kind of work together as it relates to, still continue to try and make sure we cap rent increases, we pay attention to what's going on in the eviction orders. Those are things that are definitely important to the council. We're just trying to figure out how those future policies will work. So there should be more on that in the coming weeks. And if I miss anything else, I apologize. Are there any other questions?
You've touched on all of the major topics that have been brought up.
Okay. Okay. Oh, and then of course, somebody did ask about the stadium. I might as well at least put that out there. We didn't have a chance to. That's Dave's favorite project, actually. I'd be remiss if I didn't tell him that. So as of, I believe, was it Thursday or was it Friday? We did actually receive the letter from Hall Equities officially withdrawing the IENA, and so at this time the stadium project will not be moving forward, and so we'll be looking into kind of what's next for that land. So I want to go ahead and let people know that was definitely the case. Okay. All right. Well, with that, thank you everyone for joining us today. I really appreciate that. And thank you to our different healthcare professionals that were on the call this morning. We appreciate that. And again, remember, everyone, healthcare is open. For goodness sakes, don't wait to access healthcare. And it looks like a number of things are going to be coming over the course of the next few weeks with some relaxed health orders, and a number of things are going to start opening up as it relates to not just offices and people returning to offices, and we'll see what happens around restaurants and other places of shopping. So, so thank you so much. Appreciate everybody's time, and have a wonderful morning.